10 warning signs of breast cancer. This could save your life. Did you know that right now, as you're watching this video, someone in the United States is being diagnosed with breast cancer? Every 2 minutes. That's how often it happens. In 2025, over 310,000 women and nearly 3,000 men will hear those 3 terrifying words. You have cancer. But here's what gives me hope. When breast cancer is caught early, the 5-year survival rate is 99%. That's why in the next few minutes, we're going to walk through 10 warning signs your body might be showing you right now. Some of them will surprise you. One of them happens so quietly that most people miss it until it's too late. Stay with me until the end. What is breast cancer and who's at risk? Before we dive into the warning signs, let's understand what we're dealing with. Breast cancer typically starts in the milk ducts or the glands that produce milk. At first, it's just a small group of cells behaving abnormally, growing when they shouldn't, dividing when they shouldn't stop. As these cells multiply, they form what we call a tumor. Now here's the part that makes early detection so critical. If left untreated, cancer cells don't stay put. They can break away and travel through your lymphatic system to other parts of your body, your bones, your liver, your lungs. This is called metastasis, and it's when breast cancer becomes much harder to treat. But we can catch it before that happens. Several factors increase your risk. Age is significant. Most cases occur after 50. If your mother, sister, or daughter has had breast cancer, your risk doubles. Starting your period before 12 or going through menopause after 55 exposes you to hormones longer, which can increase risk. Lifestyle matters too. Regular alcohol consumption, smoking, being overweight, and lack of exercise all contribute. And certain genetic mutations, you probably heard of BRCA1 and BRCA2, can dramatically increase your likelihood of developing breast cancer. Now, men, I haven't forgotten about you. While breast cancer in men is rare, making up less than 1% of cases, it's actually more deadly. Why? Because most men never suspect that lump could be cancer. They wait, they ignore it, and by the time they seek help, the cancer has often advanced. That's why whether you're a woman or a man, you need to know these 10 warning signs. Your life might depend on it. Warning sign number 10. A new lump in your breast or underarm. Imagine you're in the shower. Your hand brushes against your breast, and you feel something that wasn't there before, a small, hard lump. Your heart skips a beat. This is a warning sign most people know about. But here's what you need to understand. Not all lumps feel the same. A cancerous lump typically feels firm or hard, almost like a marble or a small stone under your skin. It doesn't move around easily when you press on it. It's fixed in place. The edges are often irregular rather than smooth, and it's usually painless, which is exactly why it's so dangerous. We tend to ignore things that don't hurt. But here's something critical. The lump doesn't have to be in your breast. Many breast cancers are first detected as a lump in the underarm area. Why? Because breast tissue actually extends into your armpit, and the lymph nodes are often the first place cancer cells travel. The size doesn't matter as much as you'd think. Even small lumps, smaller than a pea, can be cancerous. And here's what scares me. Many people feel a lump and think, I'll wait and see if it goes away. Please don't do this. Not every lump is cancer. In fact, most aren't. They could be cysts, fibroadenomas, or other benign conditions. But the only way to know for sure is to get it checked. Waiting could be the difference between a simple treatment and a life-threatening situation. If you feel any new lump or mass in your breast or underarm area, see a doctor within a week. Not next month. Not when you have time. Within a week. Warning sign number 9. Changes in breast size or shape. You're getting dressed one morning and something catches your eye in the mirror. One breast looks different, maybe slightly larger. Maybe the shape has changed. You tell yourself it's probably nothing. Maybe you slept funny, maybe it's hormonal. But what if it's not? Breast cancer doesn't always announce itself with a dramatic lump. Sometimes it changes the architecture of your breast from the inside, slowly altering its size or shape. Here's what's happening beneath the surface. As a tumor grows, it takes up space. It displaces normal tissue. It can pull on surrounding structures, causing one breast to appear larger, smaller, or differently shaped than the other. You might notice one breast sitting lower than the other, or the contour looking different when you raise your arms. Now, I want to be clear, many women naturally have breasts that are slightly different sizes. That's completely normal. What we're talking about here is a change. A difference you notice that wasn't there before. This change might be subtle at first. Your bra might fit differently on one side. You might notice asymmetry in photos that wasn't there 6 months ago. The key word here is new. And here's something that doesn't get talked about enough. These changes can happen even if you can't feel a lump. The tumor might be deep in the tissue or spread out rather than concentrated in one spot. Pay attention to your body. Take photos if you need to. Having a reference point can help you notice gradual changes, because catching these changes early could literally save your life. Warning sign number 8. Skin changes, dimpling, puckering, or orange peel texture. Picture this. You're looking at your breast and you notice the skin looks different. There are small indentations, almost like someone pressed their fingertips into soft clay. Or maybe the skin has a texture that reminds you of an orange peel, small pits across the surface. This is your body waving a red flag. What you're seeing is called peau d'orange, French for orange peel, and it happens when cancer cells block the tiny lymph vessels in your breast skin. Think of these vessels like microscopic drainage pipes. When they get clogged, fluid builds up in the skin, creating that distinctive dimpled, pitted appearance. Dimpling or puckering happen for a different but equally concerning reason. As a tumor grows deep in the breast tissue, it can create tension, like an invisible hand pulling the skin inward from beneath. This causes the skin to dimple or pucker, especially when you move your arm or change positions. Here's what makes this particularly insidious. These changes usually don't hurt. The skin might look different, but it feels fine, so people dismiss it. It's probably just dry skin, they think, or maybe I'm just noticing something that was always there. But skin changes like this don't happen for no reason. They're a sign that something beneath the surface is disrupting the normal structure of your breast tissue. If you notice your breast skin developing any unusual texture, dimpling, puckering, ridges, or that orange peel appearance, don't wait. This is particularly urgent if the skin also feels warm or looks red, because that could indicate inflammatory breast cancer, an aggressive form that requires immediate treatment. Warning sign number 7. Nipple changes, inversion, retraction, or unusual discharge. Let's talk about something that often gets ignored because it seems minor. Changes to your nipple. Maybe you've noticed your nipple has started turning inward, pointing in rather than out. Or perhaps it's flattened when it used to protrude. You might think, bodies change, this is probably normal aging. But what if it's not normal? What if your body is trying to tell you something? Nipple retraction happens when a tumor growing behind or near the nipple pulls on the milk ducts. Imagine tiny threads attached to your nipple from the inside. When a tumor distorts these ducts, it pulls the nipple inward. This can happen gradually over weeks or months, which is why people often don't notice until the change is significant. Now let's talk about nipple discharge. And I don't mean breast milk if you're nursing. I'm talking about fluid that comes from your nipple when you're not breastfeeding. This discharge can be clear, yellow, green, or, and this is the one that should send you straight to a doctor, bloody or blood-tinged. Here's what's happening. As cancer grows in the milk ducts, it can cause cells to break down, creating fluid, debris, or blood that leaks out through the nipple. The discharge might be spontaneous, happening without you squeezing or touching your nipple, or it might occur from one breast only. Many things can cause nipple discharge, and most aren't cancer. Hormonal changes, infections, certain medications, all of these can lead to discharge. But you can't know which one it is without getting checked. If your nipple has inverted, retracted, or if you're experiencing any unusual discharge, especially from just one breast, make an appointment this week. Not next month. This week. Warning sign number 6. Persistent pain in your breast or nipple. I want to address something that confuses a lot of people. Breast pain. You probably heard that breast cancer doesn't hurt. And in many cases, that's true. Most breast cancers are painless, which is exactly why they go undetected for so long. But here's what you need to know. Some breast cancers do cause pain, and dismissing pain because cancer doesn't hurt could be a fatal mistake. Let me paint you a picture. You have a constant, nagging ache in your breast. It's not related to your menstrual cycle. It's there all the time. It might feel like a burning sensation or a deep, throbbing pain. Sometimes it's localized to one specific spot. Other times it's more diffuse. This pain happens when a tumor presses on nerves or when inflammation occurs in the breast tissue. With inflammatory breast cancer, one of the more aggressive types, the breast often feels tender, warm, and painful because cancer cells are blocking lymph vessels and causing significant inflammation. Now, I don't want to scare you unnecessarily. Most breast pain is not cancer. Hormonal changes, cysts, injury, ill-fitting bras, all of these cause breast pain far more often than cancer does. But here's the critical distinction. Cancer-related pain is persistent. It doesn't come and go with your cycle. It doesn't improve with a better bra or pain medication. It's there day after day, sometimes getting worse. If you have breast or nipple pain that has lasted more than 2 weeks and doesn't seem connected to your menstrual cycle or any obvious cause, get evaluated. Don't let anyone, not even a doctor, dismiss your pain without proper examination and, if necessary, imaging. Mid-video engagement. Before we get to the top 5 warning signs, if this is helping you understand what to look for, a quick like helps this reach more people. And subscribe if you want more health information that could genuinely make a difference. Now, let's talk about warning sign number 5, and this one is subtle. Warning sign number 5. Swelling in part of your breast. Swelling. It sounds simple, but it's one of the most misunderstood warning signs. You might not feel a distinct lump, but you notice an area of your breast feels thicker or fuller than the rest. Maybe it's a general puffiness. Maybe when you press on it, the tissue feels denser than the surrounding area. This swelling happens because cancer cells can cause inflammation as they grow. Even without forming a distinct lump, they're disrupting the normal breast tissue architecture, causing fluid buildup and tissue changes that create a swollen appearance or feeling. Here's what makes this tricky. The swelling might come and go, especially in premenopausal women whose breasts naturally change with their cycle. So how do you know if it's hormonal or something more serious? Pay attention to these details. Is the swelling in the same spot consistently? Does it persist after your period ends? Is it only in one breast? Does that area also feel warm or look different? Inflammatory breast cancer often presents with swelling rather than a lump. The entire breast or a large section might become swollen, red, and warm, looking almost like an infection. This type of cancer is aggressive and grows quickly. So if you notice these symptoms, don't wait to see if they resolve on their own. Swelling accompanied by any redness, warmth, or rapid increase in breast size needs same-day medical attention. I'm not exaggerating. Same day. Warning sign number 4. Redness or rash on your breast. Let me ask you something. If you saw a rash on your breast, what would you think it was? Eczema? An allergic reaction to your laundry detergent? Maybe a heat rash? That's what most people think. And that's why they wait weeks or even months before seeing a doctor. Precious time when cancer could be spreading. A red, inflamed breast can be a sign of inflammatory breast cancer, which I keep mentioning because it's particularly aggressive and often misdiagnosed. The redness occurs because cancer cells are blocking lymph vessels in the skin, causing inflammation and a red, sometimes warm appearance that can look remarkably like a skin infection or rash. Unlike a typical rash, cancer-related redness usually doesn't itch intensely, doesn't respond to skin creams or antihistamines, and doesn't improve over time. It might cover a large portion of your breast, sometimes more than 1/3 of the breast surface. The skin might also feel thicker or warmer than usual. You might notice the redness spreads quickly over days or weeks. And here's a key detail. If your doctor gives you antibiotics thinking it's an infection and the redness doesn't improve after a week, that's a major red flag. I cannot stress this enough. Do not spend weeks trying to treat breast redness with over-the-counter skin products. If redness persists for more than a few days, especially if it's accompanied by swelling, warmth, or pain, see a doctor immediately and specifically ask about inflammatory breast cancer. This form of cancer can progress rapidly. Days matter. Please don't wait. Warning sign number 3. Swollen lymph nodes in your armpit or near your collarbone. Your lymph nodes are like security checkpoints in your body, small, bean-shaped filters that trap harmful substances, including cancer cells. And when breast cancer starts to spread, the lymph nodes in your armpit and near your collarbone are usually the first places it goes. You might feel these swollen nodes as small, firm lumps under the skin in your armpit or just above your collarbone. They might feel tender when you press on them, or they might not hurt at all. They could be as small as a pea or as large as a grape. Here's why this happens. When breast cancer cells break away from the primary tumor, they travel through lymph vessels to nearby lymph nodes. Once there, they continue multiplying, causing the nodes to swell. Now, swollen lymph nodes don't automatically mean cancer. They swell for all sorts of reasons: infections, immune responses. Even a scratch on your hand can cause lymph nodes in your armpit to enlarge temporarily. But there are some characteristics that should concern you. If the swollen nodes are hard and immovable, not soft and mobile like they are with an infection, if they persist for more than 2 weeks, if they're painless, if you have other symptoms on this list happening simultaneously, check your armpit area regularly. Raise your arm and use the opposite hand to feel around in your armpit and along your collarbone. You're feeling for anything unusual, any firmness or lumps that weren't there before. If you find swollen lymph nodes that don't go away within 2 weeks, get them checked. This could be your body's way of showing you that cancer is trying to spread. Warning sign number 2, persistent itching or irritation. Itching. It seems so innocent, doesn't it? You probably wouldn't think twice about an itchy breast. You'd scratch it and move on with your day. But what if that just doesn't go away? What if your breast or nipple has been persistently itchy for weeks, and nothing you do makes it better? This is particularly associated with inflammatory breast cancer and Paget's disease of the breast, a rare type of cancer that affects the nipple and areola. With Paget's disease, the nipple and the darker area around it might become itchy, scaly, or crusty. It can look remarkably like eczema or a simple skin condition. The itching happens because cancer cells are irritating the skin and disrupting its normal function. You might also notice the skin on your nipple or areola becomes flaky, thickened, or develops a rash-like appearance. Some people describe a burning or tingling sensation rather than pure itching. Here's what you need to watch for. Does the itching persist for more than 2 weeks? Is it accompanied by any changes to the skin texture, scaling, crusting, or thickening? Is it only affecting one breast? Does it come with any other symptoms we've discussed? Many women spend months treating this as a skin problem, applying creams and moisturizers, when what they really have is breast cancer affecting the skin. Don't let this be you. If you have persistent itching on your breast or nipple, especially with any visible skin changes, see a doctor and specifically mention your concern about Paget's disease. Don't let them dismiss it as dry skin without proper examination. Warning sign number 1, a lump that changes or grows. We've reached the number 1 warning sign, and this is the one that scares me the most because people often wait too long. You've had a lump in your breast for a while, maybe months, maybe even years. Your doctor checked it before and said it was just a cyst or benign fibrous lump. You've been monitoring it, and it's been stable until now. Recently, you've noticed it feels different. Maybe it's gotten bigger. Maybe it's changed shape. Maybe it feels harder than before. Or maybe it started causing symptoms it never caused before: pain, dimpling of the overlying skin, or changes in surrounding tissue. Here's the critical truth. Just because a lump was benign before doesn't mean it's benign now. And just because you've had a lump for years doesn't mean you should ignore changes to it. Cancer can develop in tissue that previously had benign lumps. More commonly, what was initially evaluated as benign might have been cancer all along, especially if imaging wasn't clear or the evaluation wasn't thorough enough. Any lump that changes, grows larger, becomes harder, becomes fixed to surrounding tissue, or starts causing symptoms, needs immediate reevaluation. Immediate means within days, not weeks.